In this video, we'll be taking a look at the bones of the arm and of course the wrist and the hand along with that. And we've shown these before when we talked about the appendicular skeleton. This right here is the humerus. That's the bone of your upper arm. And then these two bones right here are the bones of your radius and ulna of your forearm. Right now I've got a hold of the ulna, and I'm pivoting it back and forth on this little circular head of the radius. We'll look at those very closely. But your arms are very important, the motion allowed in your arms. See, I'm doing that same movement, that rotational movement that I was doing with that model. So let's take a close look at the humerus. And with the humerus, we've got to be able to tell the front from the back. So I'm holding the humerus up. Is that the front side or is that the back side of the humerus? Okay, if you guess the front side, you got it right. If you guess the back side, you got it wrong. You had a 50-50 chance. Okay, but that's fair enough. Okay, so now that is the front part of the humerus. This is the back part of the humerus. The way I tell, there's different ways to tell, but you see right down here, that's called the olecranon fossa, and the olecranon process. This is the ulna bone. The olecranon process of that fits into that fossa to make up what's known as your elbow. That's your funny bone. When you bang that thing down, boy, that thing hurts. So this is the back of the humerus with the olecranon process, and this is the front. It looks different. We'll look at it in detail. The other thing you have to know is what's the lateral side of the bone and what's the medial side of the bone. Is this the lateral side or the medial side? Go ahead and guess. You got it 50-50. Okay. If you guess lateral, you got it wrong. If you guess medial, you got it right. You know it's the medial side of the bone because right up here you've got the head of the humerus, and that fits in to, remember, the glenoid fossa, or the glenoid cavity on the scapula. That fits in there, so this has to be the medial side toward the body, and this is the lateral side. Okay, so now that we've got that straightened out, we're looking at the front of the humerus, and we're looking at it from the top of it, the front of it. This is the medial side. So this is the head of the humerus that articulates with the scapula at the glenoid fossa. Then you have two bumps, okay, this one on the outside, this one on the inside. Oops, kind of hard to, because I'm working at it from the back. There's a bump there. The bump on the lateral side is called the greater tubercle. That's this one here on the lateral side, the greater tubercle. The bump on the inside is called the lesser tubercle. Then if you look between the greater tubercle and the lesser tubercle, you'll see a groove, and that's called the intertubercular groove. It's the groove between the tubercles. So here's the head, here's the greater trochanter, greater tubercle, here's the lesser tubercle, and here's the intertubercular notch. Okay, 4 things up there. It's also called the bicipital groove, but that's not that important. Okay, down here you'll feel a bump. You have to feel it. That's called the deltoid tuberosity. Deltoid tuberosity. Okay, so this is the proximal end. The head, the greater trochanter. Boy, this is hard. Greater trochanter, lesser trochanter, the not trochanter. Trochanters are on the femur. We're going to see those. This is the greater tubercle. This is the lesser tubercle. This is the intertubercular groove, and that's the head. We'll get it right. Then down here, this bump is called the deltoid tuberosity. That's a big bump that the deltoid muscle fits onto. Okay, so we got the top end of the anterior side of the bone studied. Okay, now we go down to the bottom end, and there's a lot going on down here. Okay, we got the capitulum right here. Okay, that and this is this the lateral or the medial side? Come on down. It's the lateral side, so the capitulum is on the lateral side. And then we have here, we've got the trochlea. The trochlea. See, I'm putting my finger. Here's the capitulum, and here's the trochlea. And then we have a fossa right there, which is there's two of them actually. There's the radial fossa, which is the one on this side. There, if you look closely, there's two of them. There's the radial fossa, and then there is the coronoid fossa on the lateral side. Okay, so that's what you look for on the bottom. Okay, what is this? This is the capitulum. Okay, this right here is the trochlea. The trochlea. Okay, then you have two fossa in the front, the radial fossa and the coronoid fossa. Okay, so that's that part of the bone. Now we'll turn around. There's a couple of ridges up here, but we're not going to mess with them because the names get real long. Okay, if we look on the back, what we're seeing right now is one thing you need to know on the back. There's a radial groove. The radial groove is for the radius muscle. We'll talk about that later. And down here, this is very important. This is the olecranon fossa. The olecranon fossa. Okay. And then we also have, well, those are the main features. I'm not going to worry about this. You remember, this is, if you turn it around, that's the capitulum, and that's the trochlea. And on the back, you can see the trochlea from the back too. That's right down here. It's got two sides to it, and there's a tendon that goes through there that moves back and forth when you extend and flex your forearm. Okay. So what's this? This is the olecranon fossa. Fossa is a cavity or depression. So let's review the humerus. It was kind of humorous about how we got through it. Ha 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 ha. Humorous, funny. You see what I mean? Okay, so let's start out with, this is the front side of the humerus, top, bottom. This, a better term, this would be the proximal end, and this is the distal end. Okay, and then what you see at the top, at the proximal end, is the head of the humerus. Then you see on the outside the greater tubercle, on the inside the lesser tubercle. Then you see the intertubercular groove, and then down here you see the deltoid tuberosity, the bump. Now we go down to the distal end, and we see the capitulum, we see the trochlea, see, and then we see the two fossas, the radial fossa and the coronoid fossa. Okay, so that is the anterior part. We turn the bone over, we see the posterior part. Okay, we have the radial groove right here in the middle of the posterior part. I think I called it tuberosity before. There's a difference between a tuberosity and a groove. A tuberosity is a big bump. A groove is a little depression. Okay, and here's the back. This is the important one. What is this? That is the what? The olecranon fossa. When we look at the ulna, we're going to see that the olecranon process of that bone goes in there to form your elbow joint. This down here is the trochlea.